Reports from the global tourism sector indicate a significant shift in travel patterns across South America following a series of high-profile medical emergencies linked to the Andes hantavirus. What began as an isolated public health concern has rapidly evolved into a logistical and economic challenge for the region's travel industry, as international health agencies coordinate a multi-country response to a rare maritime outbreak. The focus of the current crisis centers on the MV Hondius, a Dutch-flagged expedition vessel that departed from Ushuaia, Argentina, in early April 2026. While hantaviruses are a known endemic threat in rural parts of the southern cone, this specific incident has drawn unprecedented attention because it involves the Andes virus strain, which is uniquely characterized by its potential for person-to-person transmission. The situation has triggered a wave of cancellations among travelers planning excursions to the rugged interior of Argentina, Chile, and Uruguay, where the virus is naturally occurring. +2. To understand the current alarm, it is necessary to examine the specific nature of the hantaviruses circulating in the Americas. Unlike the strains found in Europe and Asia, which typically manifest as hemorrhagic fever with renal syndrome, the New World hantaviruses cause Hantavirus Pulmonary Syndrome, or HPS. This is a severe, often fatal respiratory disease. The Andes virus, the specific agent identified in the recent cluster, is primarily carried by the long-tailed pygmy rice rat. Public health officials emphasize that while the virus is usually contracted through the inhalation of aerosolized droppings or urine from infected rodents, the Andes strain remains the only known hantavirus capable of spreading between humans through close, prolonged contact. This biological distinction is at the heart of the current tourism downturn, as the perception of a communicable respiratory threat often leads to more immediate and widespread panic than a strictly zoonotic one. +2. The timeline of the current outbreak illustrates the complexities of monitoring a virus with a lengthy incubation period, which can range from 1 to 8 weeks. The World Health Organization was first notified of a cluster of severe acute respiratory illness on May 2, 2026, after the MV Hondius reported multiple passengers and crew members falling ill with life-threatening symptoms. By the time the vessel reached the Canary Islands for medical assessment, at least 3 fatalities had been confirmed, with a case fatality rate hovering near 38%. These figures have resonated deeply with the traveling public, creating a narrative of high risk that officials are now struggling to contextualize. While the World Health Organization and the Pan American Health Organization currently advise against broad travel or trade restrictions, the psychological impact on the tourism market has been immediate. Tour operators in Patagonia and the Lake District of Chile report that the end of tourism sentiment is being driven by a lack of clarity regarding where and how the initial exposure occurred. +2. The primary framing of this story is not just one of a medical outbreak, but of the vulnerability of global travel networks to specialized regional pathogens. For decades, hantavirus was viewed as a localized risk for farmers, forestry workers, or those clearing out long-dormant rural sheds. The transition of this risk into the high-end expedition cruise market represents a significant shift in public health reporting. As laboratories in the Netherlands, Switzerland, and the United States work to sequence the viral genome from the latest cases, the primary goal remains identifying the precise environmental source. Until that source is confirmed and the risk of further human-to-human transmission is ruled out, the shadow cast over South American tourism is likely to persist, forcing a reevaluation of how health screenings are conducted for long-term travelers entering enclosed cruise environments. The core of the current investigation revolves around the movements of a single index case and the subsequent international effort to track the spread of the virus across several continents. According to reports from the Argentina Ministry of Health and the World Health Organization, the primary individual suspected of introducing the virus to the MV Hondius was a Dutch citizen who had completed a 4-month overland road trip through rural regions of Argentina, Chile, and Uruguay before boarding the vessel on April 1. This traveler began showing symptoms of fever and malaise just 5 days after the ship left port in Ushuaia. By April 11th, the individual had died while the ship was in the South Atlantic. This timeline is critical for epidemiologists, as it suggests the initial exposure occurred on land, within the endemic zones of the southern cone, rather than on the ship itself. However, the subsequent appearance of symptoms in other passengers and crew members, weeks later, has forced a rigorous look at the ship's ventilation systems and the possibility of secondary transmission in the close quarters of an expedition vessel. +1. The logistical scale of the response is immense, involving health agencies from the United Kingdom, the Netherlands, Germany, and the United States. As of mid-May 2026, confirmed cases have been hospitalized in facilities as far-reaching as Johannesburg, Rotterdam, and Nebraska. The Centers for Disease Control and Prevention in the United States issued a Health Alert Network advisory to inform clinicians about the potential for imported cases. In a highly coordinated move, the CDC dispatched a specialized team to the Canary Islands to meet the ship and facilitate the repatriation of American passengers to a high-containment facility in Omaha. This level of intervention is reserved for pathogens with high mortality rates and the potential for transmission in healthcare settings. At the laboratory level, the use of virus-specific polymerase chain reaction, or PCR, and next-generation sequencing has allowed scientists to confirm the presence of the Andes virus with high precision. These tests are essential because the early symptoms of hantavirus, fever, muscle aches, and fatigue, are virtually indistinguishable from common influenza or other respiratory infections, often leading to delays in the life-saving supportive care required for HPS patients. +1. Contrasting the official claims of international health bodies with the observed reality on the ground reveals a tension between economic stability and public safety. While the World Health Organization maintains that the global risk remains low, the Pan American Health Organization has been forced to activate intensified surveillance measures across 8 countries in the Americas. In 2025 alone, the region reported over 200 confirmed cases and dozens of deaths, indicating that the virus was already in a period of high activity prior to the cruise ship incident. The current data from 2026 suggests that the seasonal peak is coinciding with the surge in travel, creating a perfect storm for exposure. In India and other distant markets, health ministries have activated precautionary surveillance, reflecting the globalized nature of modern travel, where a pathogen from a remote Argentinian forest can reach a major metropolis within 48 hours. Public health agencies are also examining the role of shipping and trade logistics in the spread of zoonotic diseases. While there is no evidence that the virus is being transported via cargo, the movement of people who have spent time in rodent-endemic areas remains the primary vector for geographical spread. The Andes virus represents a unique challenge for quarantine protocols. Because the incubation period is so long, a traveler can be exposed in South America, fly to Europe or North America, and remain asymptomatic for weeks before suddenly entering the cardiopulmonary phase, where the lungs fill with fluid and the heart begins to fail. This rapid deterioration is what necessitates the intensive care involvement seen in the current cluster. For now, the verified information points to a localized land-based exposure that transitioned into a mobile maritime environment, leaving many questions about the efficacy of current pre-boarding health screenings. For long-haul expedition travelers, prevention and surveillance remain the most effective tools in the absence of a licensed vaccine or specific antiviral treatment for hantavirus. Public health guidance issued by the Pan American Health Organization and the CDC continues to focus on the elimination of rodent-human contact. In South America, authorities are emphasizing the 3 pillars of prevention: sealing entry points into buildings, using traps and professional pest control, and practicing safe cleaning methods. Officials warn that the most dangerous activity is disturbing dust or nesting materials in enclosed spaces, such as cabins, sheds, or storage units. The standard recommendation is to soak suspected areas with a mixture of bleach and water for at least 5 minutes before cleaning, using gloves and, in some cases, specialized respirators to prevent the inhalation of aerosolized viral particles. This guidance is now being adapted for the tourism sector, with calls for more rigorous inspections of remote lodges and seasonal campsites popular with international backpackers. The surveillance networks are currently operating at a heightened state of alert. The international health regulations focal points are working to trace over 140 passengers and crew who may have been exposed on the MV Hondius, many of whom have already returned to their home countries. This international contact tracing is a massive undertaking, requiring the monitoring of individuals across 23 different nations. The goal is to ensure that anyone who develops a fever or respiratory distress is immediately isolated and tested for the Andes virus. Despite these efforts, officials admit to honest limits in their current knowledge. For example, while the Andes strain is known to spread between humans, the exact level of close contact required is still being debated. Past outbreaks in Argentina and Chile suggest that household members and sexual partners are at the highest risk. But the dynamics of a shared ventilation system on a ship present a new variable that researchers are still analyzing. There is also a significant gap in treatment capabilities. Currently, the medical community relies entirely on early supportive care, which includes mechanical ventilation and, in extreme cases, extracorporeal membrane oxygenation, or ECMO. Because the virus causes the capillaries in the lungs to leak, fluid management is incredibly delicate. Patients who receive treatment in highly specialized intensive care units have a much higher chance of survival. But for travelers in remote parts of South America, the distance to such facilities can be a fatal hurdle. This reality is what has prompted many travelers to heed the end of tourism warnings, as the risk-reward calculation of visiting remote endemic zones changes when the medical infrastructure is hours or days away. Plus, too, as the situation evolves, the closing sentiment from health officials is one of cautious transparency. They are working to provide the public with clear, non-graphic information that balances the severity of the disease with the statistical rarity of infection for the average visitor. The current maritime cluster is an anomaly that highlights the need for better integration between the travel industry and global health surveillance. While the immediate panic may eventually subside, the 2026 hantavirus outbreak has already left a lasting mark on how we perceive the safety of international expeditions. For the latest updates on global public health reporting and emerging viral threats, consider subscribing to our channel for continued coverage of these developing stories. In the meantime, international travelers are encouraged to consult the latest health notices from their respective government agencies before finalizing plans for trips into endemic regions. The core of the current public health investigation centers on the precise movements of the MV Hondius and the subsequent international effort to trace a cluster of infections across several continents. According to the World Health Organization and the Argentine Ministry of Health, the epidemiological investigation began in earnest on May 2, 2026, following reports of a severe acute respiratory illness cluster among passengers who had recently disembarked or were still transit through international hubs. The primary index case has been identified as a Dutch national who had concluded a 4-month overland expedition through rural regions of Argentina, Chile, and Uruguay before boarding the vessel in Ushuaia on April 1. Medical records indicate this individual began showing symptoms of fever and myalgia on April 5, eventually succumbing to the illness on April 11 while the ship was in the South Atlantic. This specific timeline is critical for global health agencies because it suggests the initial exposure occurred on land within the known endemic zones of the southern cone, rather than through a rodent reservoir on the ship itself. However, the subsequent appearance of symptoms in other passengers and crew members weeks later has forced a rigorous re-examination of the ship's communal spaces and the potential for secondary human-to-human transmission, a characteristic unique to the Andes orthohantavirus strain. The logistical scale of the response is immense, involving a coordinated effort between the Centers for Disease Control and Prevention in the United States, the Robert Koch Institute in Germany, and the Netherlands National Institute for Public Health and the Environment. As of the current reporting period, confirmed cases linked to this travel cluster have been hospitalized in facilities as far-reaching as Johannesburg, Rotterdam, and the Specialized Biocontainment Unit in Omaha, Nebraska. The CDC recently issued a Health Alert Network advisory to clinicians worldwide, emphasizing the need for detailed travel histories when treating patients with sudden-onset respiratory distress. In a highly structured move, health officials met the MV Hondius at the Canary Islands to conduct a full medical census of the 71 passengers and crew. At the laboratory level, the use of virus-specific polymerase chain reaction, or PCR, and next-generation sequencing has allowed scientists at the Erasmus Medical Center to confirm the viral genome with high precision. These tests are vital because the early symptoms of hantavirus, including headache, abdominal pain, and extreme fatigue, are often mistaken for common influenza or even seasickness, leading to a dangerous delay in the administration of intensive supportive care. While official statements from the Pan American Health Organization suggest the overall global risk remains low, the end of tourism narrative has gained traction due to the observed case fatality rate, which currently sits near 38% for this specific cluster. This high mortality rate, combined with the virus's long incubation period of up to 8 weeks, has created a significant challenge for the travel industry. Logistics and shipping experts note that the tourism downturn in Patagonia and the Lake District is not merely a reaction to the infections themselves, but to the stringent quarantine protocols being considered for travelers entering from endemic regions. Major tour operators in Bariloche and Punta Arenas have reported a cascade of cancellations, with some agencies seeing a 60% drop in bookings for the upcoming winter season. The contrast between agency claims of a contained event and the reality of a global traceback operation involving 23 nations has led to a crisis of confidence among international travelers beyond the medical data. The investigation is exploring the intersection of climate patterns and rodent population surges, known locally as La Ratada. Public health laboratories in Buenos Aires and Santiago are currently analyzing whether an increase in the population of the long-tailed pygmy rice rat, the primary reservoir for the Andes virus, contributed to a higher environmental viral load during the early 2026 season. Surveillance data from 2025 already showed a marked increase in zoonotic activity in the region, with over 300 confirmed cases reported across the southern cone. This historical context is being used by agencies to refine travel advisories, though the focus remains on the rare person-to-person transmission seen on the MV Hondius. As the investigation continues, the primary goal for labs is to determine if the virus has undergone any significant mutations that might enhance its stability in aerosolized form or its ability to spread in enclosed environments like cruise ships and long-haul aircraft. Until these genomic studies are finalized, health officials are maintaining a stance of extreme caution, advising that any traveler returning from the region who develops a fever within 60 days should seek immediate medical attention and disclose their travel history to high-risk zones. In the wake of the MV Hondius cluster, global public health authorities are intensifying their focus on prevention and surveillance as the primary defense against a pathogen for which there is currently no licensed vaccine or specific antiviral treatment. The World Health Organization and the Pan American Health Organization have issued updated guidance for both residents and international travelers in the Southern Cone, emphasizing that the reduction of rodent-to-human contact remains the most effective mitigation strategy. Public guidance focuses on the 3 pillars of environmental management: sealing entry points into buildings, using professional pest control to eliminate rodent populations near human dwellings, and practicing safe cleaning methods in areas where rodents may have nested. Because hantavirus is primarily contracted through the inhalation of aerosolized droppings, urine, or saliva, officials stress that individuals should never sweep or vacuum suspected areas. Instead, the standard protocol involves thoroughly soaking the area with a 10% bleach solution, 1 part bleach to 9 parts water, and allowing it to sit for at least 5 minutes before cleaning with paper towels or a mop. In rural settings, particularly in the Ratada zones of Patagonia, the use of N95 or higher-rated respirators is increasingly recommended for anyone clearing out seasonal cabins or storage units that have been closed for the winter. The clinical reality of Hantavirus Pulmonary Syndrome, or HPS, presents a significant challenge for surveillance networks due to the virus's rapid progression once the cardiopulmonary phase begins. For travelers, the practical takeaway is the necessity of immediate medical intervention at the first sign of unexplained fever or muscle aches following a visit to an endemic region. However, the limits of current medical knowledge remain a source of concern for public health officials. While early supportive care in an intensive care unit can significantly improve survival rates, the infrastructure required, such as mechanical ventilation and extracorporeal membrane oxygenation, or ECMO, is often unavailable in the remote, rural areas where exposure is most likely to occur. Furthermore, the mystery of the Andes strain's person-to-person transmission continues to be a subject of intense study. Scientists are currently investigating the dose-response relationship to determine why some close contacts become infected while others do not. This uncertainty has led to more conservative quarantine measures for those exposed in the current maritime cluster, as officials worked to rule out any potential for wider community spread beyond the immediate ship environment. Ethically, the reporting on the end of tourism in South America requires a careful balance between acknowledging the severity of the virus and preventing undue panic that could devastate local economies. Tourism is a vital source of income for the communities of the Andes, and health officials are working to shift the narrative from one of total avoidance to one of informed risk management. This involves a collaborative effort between the travel industry and health agencies to ensure that lodges, cruise ships, and trekking companies adhere to rigorous rodent-proofing and ventilation standards. International health surveillance is now more integrated than ever, with the international health regulations focal points in 23 countries maintaining a state of high alert. The ongoing genomic sequencing of the 2026 Andes virus samples will be vital in determining if the virus is evolving in ways that increase its transmissibility or environmental stability. Until those findings are released, the primary advice for the public remains one of heightened vigilance and strict adherence to established hygiene protocols. The honest limit of our current knowledge is that as humans continue to push into remote wilderness areas and climate patterns shift rodent populations, the frequency of these zoonotic spillover events may increase. The situation involving the MV Hondius serves as a stark reminder of how a localized environmental pathogen can quickly become a complex international logistical challenge. While the high fatality rate is a sober reality, the coordinated response from global agencies highlights a robust infrastructure designed to contain such threats before they escalate into larger outbreaks. As the investigation moves into its next phase, the focus will remain on tracing the final contacts and ensuring that the lessons learned from this maritime incident are applied to future travel health screenings worldwide. For continued coverage of global public health surveillance and breaking reports on emerging viral threats, please consider subscribing to our channel. Our team remains committed to providing factual, data-driven reporting on the stories that impact global safety and travel.